Thank you for joining me tonight. I appreciate Carolina Breast Friends having me talk with families again. I spoke, I think it was a couple months back, and tonight I'm going to give some information about how we can help your families cope and children cope with an illness. So I'll give you just a little bit of my background and what I do. I've been a child life specialist for about 23 years now. So I've worked in different types of, hospital setting, or I've worked in pediatric rehab, but across all of my years, I've worked in the PZD, the PICU, the NICU, med-surg, rehab, PZD, HEMOC. I think that covers the gamut of everybody. And right now I'm actually doing PRN work in the adult ICUs at Atrium. So I've switched. I was at Hemby for about 14 years, and I just switched last year. And now I'm working with children of adult patients, which is an area that I really wanted to work in my private practice. So that's really where I spend the majority of my time, seeing all the kids and families in a private practice. And I do some contract work with a couple different facilities through my private practice. I work with Kindermorn. I don't know if you've all heard of Kindermorn. It's a local organization, grief organization. So I work with them doing school groups, and then I do a weekly group at the house too for the young kids. And then I also, I'm contracted with, through my practice, Carolina Caring, and it's called Cardinal Kids. It's a pediatric hospice and palliative care. So I see a lot of siblings through there, a lot of their patients. So that's kind of, and I just started working. Sorry, you get my whole spiel. I also just started doing some support with an organization called Hope for HIE. So I'm doing virtual support to kind of get their sibling program going. And I've been trying to make some contacts to, just nationwide on how we can support siblings. And then I talked with someone today and I was like, what about children of adult patients? Have you started a program for that group yet? So that's on everybody's radar, and we're working on that in the child life community. But that's a little bit about me and what I'm doing and my background. So I'm going to go ahead and share my screen with you guys so you can see a little bit more of what I'm going to be going through. Okay. I just want to give you a little bit of goals that what we're going to be talking about tonight. Like I said, this is coping skills, how we can help you and your children cope with an illness. So provide a little bit of information just about child life in general and, what child life is, offer suggestions of age appropriate coping skills, provide some connection activities meaning what you can do with your children when you're not with them. There's tends to be a lot of separation anxiety during an illness. Family activities, and then at the end, resources. So child life, I don't know if anybody knows what child life is, but child life specialists, we are educated and clinically trained in the developmental impact of illness and injury. So we help kids and families cope, whether that's with a new diagnosis, an acute diagnosis, chronic diagnosis, trauma, injury, bereavement, end of life. All of that typically is involved in a healthcare setting, but it also extends into the community setting. And we do that through therapeutic interventions, educations, preparations for procedures, anything that will help prepare them and help decrease that anxiety, that pain, that fear that they're having. So that's different, obviously, when we're talking with children of adult patients versus a pediatric patient that's going through the procedure. But again, we have the foundational skills, and then we implement the same things for kids. Before I get into the good stuff of the activities and things you can actually do, I did want to touch a little bit on this. Kind of refers a little bit back to what we talked about before of what we need to be sure to mention or talk about or kind of take note of when you're talking with your children. And one thing is just to be honest, because kids are picking up on things going on around your house, whether it's visitors coming and going a little bit more, maybe you're resting more, there's more doctor's appointments, there's whispered phone calls. Kids pick up on that. And if they don't know what's actually going on, they're going to start making things up in their head. And that's where the anxiety and the fear comes from. So just being honest and using concrete terms. It doesn't need to be anything too elaborate, but just concrete, brief conversations, obviously for the younger. And as kids get older, you can get into more details. But this is hard stuff, and we're going to go through this together. And I'm here to listen, and so you can label other people that are there to listen as well. And then to kind of find out where they're at and what they understand, ask them, like, what have you noticed? Let's process this together. What have you noticed? What makes you ask that question? What did you see, or what did you hear? Did you hear somebody? There's so many times I've talked with kids and they're like, well, I heard, my grandma said blah, 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 and that kind of starts a conversation. And we have to do some, definitely clearing up misconceptions of why she heard a piece of it and she didn't hear the whole conversation. Another big thing for kids is talking about the daily routine. You just want to make sure they know, because when their person who takes care of them and does everything for them and they can count on is sick or can't be there all the time, their fear is, what's going to happen to me? How is this going to affect me? So I know you get home at 3:00 and I won't be there, but grandma will be there. Dad will be there. Aunt will be there. And so is going to pick you up from practice. Letting them know what's going to happen next or what their weekly schedule is like can be beneficial. And then kind of like what I said, help them identify a couple other people. If I'm not available, you have all these other people in your life that love you and take care of you. It could be a teacher or a counselor at school, but kind of give them that list. So if I'm not here, you still have other people that are going to help you and take care of you. That's always going to be done. Modeling the different feelings, what's going to happen, that all those deserve attention. Let's acknowledge those. You might be crying as an adult. I'm sad. I'm really sad and I'm scared. And modeling that lets them know that it's okay to feel that way too. Identify coping techniques that they can do or that you can work on together. We're going to go through a lot of that tonight. And then work together on finding those positives. These are not good situations. These situations might be really sad, hard, but helping find the positive or the grateful things is a great coping tool to use. And I have a lot of kids that I work with, in some of my groups, that's how we start our group. Let's at least think of, I told them the other day, I'm like, I was grateful that I did not have to stop and get gas in my car today on the way. It can be tiny. It does not have to be a big thing, but acknowledging those is helpful. Okay, I'm going to move this screen. Sorry, bear with me for a moment, for a little bit. So just different coping strategies. I have a list of a ton. These are kind of some basic ones, and you can adjust them for age, school age and teens. There's tons of different things. And I try to hit on all the different sensory aspects, right? So if they're having a lot of big feelings, that's how I always describe it to kids. You're having a lot of, you're sad. It's okay if you're sad, but it's when the sad keeps going and it keeps going, and then it becomes a big worry. And we need to divert that worry into something else. Like we need to start thinking of something else so you're not worrying constantly about it. So let's eat some sour candy. That's, a taste, right? It's a sensory. Let's blow some bubbles. Let's go outside and go for a walk. Let's throw a ball. Pets are great. I have so many young kids, older kids too. Their pet is such a great comfort to them. It's relaxing. They can take their pet for a walk. Pets are great listeners. Cleaning and organizing, it's an accomplishment, and it's going to keep you focused on something. So that can always be good. A bath or a shower, a warm bath or a warm shower. It's just relaxing. Again, changes the focus. Board games, ripping up paper is a great one for anger, like if you're really mad. Another one that I recently just did with a kiddo, and we adjusted it a little bit. I added some extra stuff, but I throw ice cubes outside. I don't know if I wrote that on my other side, but throwing ice cubes outside is a great one. Take it outside, throw it on the street, because if you're mad, I always tell them you can't destroy anything or property. You can't hurt yourself or anyone else. But if you want to go outside and throw some ice cubes to let some anger out, think of something you're mad at, it's just going to break all over the concrete and it's just going to melt. So that's a good one to use for kids that really have to let some anger out. And then for your teens, it can be a little bit more involved, volunteering. I've had lots of kids ask me, somewhere they wanted to volunteer. So when you do good stuff for other people, it helps you feel good and helps you have another focus. Cooking and baking, they can do that on their own. Try some yoga, try some meditation. Maybe you've never done it, but try it. It can be helpful. It can be calming. You can do it on YouTube. A lot of teens like music. They love to listen to music. That's a huge one for them. Organizing something, drinking hot tea, hot chocolate, doing jewelry, like you're being creative. So some of these are like good creative expression. I always encourage kids to draw or color or write or paint. If you don't want to talk about it, write about it, draw it. That works too. These are hard things to talk about. And sometimes it's easier if you just write it out or draw it instead of talking about it. And we can talk, I think I have a thing that we can talk about a little bit more of how we can make that kind of come to life a little bit more. Oh, sorry. Sorry. Okay, sorry. I'm gonna move you guys around. So a family coping strategy, writing a letter to the illness, is kind of like what I just mentioned. A great way for them to talk about what's making them angry. What do they want to know? This is hard to talk about for a lot of kids, and it might be uncomfortable. So if you, whether you do this all together as a family, or you're like, here's your notebook, here's your paper. These are just prompts that I have on here. So you could really write some prompts ahead of time in like a little book, a notebook, and then they can go through and answer it and fill it out, or you can say it out loud and then they can write it as you're saying it. If it's younger kids, they can just draw it. It's okay to draw. That's, equally as beneficial. And then you can talk about it after, or you can read it and be like, then you go to them. A kid coming to you is harder. Being like, hey, I need to talk about this. That's hard. And it can take a lot of courage. So you as the adult or the parent can go to them and be like, hey, I saw you wrote this down. I'm here. Let's talk about this. This is what this means. Grateful jars or share gratefuls. I mentioned this before, just mentioning the things or talking about the things you're grateful for. It can be tiny things. And a way you can do that is have a jar on the kitchen counter or wherever in your house, in the living room, and everybody writes down something they're grateful for and you stick it in the jar once a day, once a week, twice a week. Share, or you can just share a grateful when we're having dinner, or do it at bedtime. But it really is a great coping strategy to remember the positives and the good things when things are really hard. It's a great coping strategy so you're not going down such a negative road of like just mental health and thoughts. Excuse me. Creating a home coping kit. That's this little picture over here. I call it, and I've called it with many kids, we make a break box. So if kids are having a lot of anxiety, fears, we make a break box. We get a shoebox and we decorate it and we put paint on it and glitter and stickers and their name and whatever they want to do. And they will take so much time sometimes doing this. And then we fill it with, I have these little, you can see this squeezy ball. This is one of my favorite things to put in there. These little calming things, just to look at. Fidgets. I have just this little beady fidget. Can you see this beady fidget? And it's just to go back and forth. Poppets. And then I've also done small cards that I've laminated, or you can just put them, you don't have to laminate them, obviously, but breathing exercises, like there's a star and it shows you the direction to breathe in like a star. There's one that's a rainbow and you can put that in there. Just different things to help them kind of, again, they need a break, they need an outlet. This can be something you can make. You can put gum in there or candies, Play-Doh, like anything that they can just go and have that time to let some stress out or calm down. Plan a time for talking about the illness. This can be done with all of you as a family, but it can also be done individually. Like you're going to pick, your child, you guys are going to go get ice cream once a week. And during that time, we're going to go get ice cream, but that's when we're going to talk about my illness. And that's when you get to ask questions. I will answer you the best that I can. We can share and talk about anything you want during that time. Or we're going to go play basket every night at 6:30 in the driveway for 20 minutes. And during that time, while we're playing, we're going to talk about this. They can ask, same thing, doing Legos, playing Barbies, whatever it is you're doing, whatever their thing is, do their thing with them. And But when I'm doing that with you, we're going to talk about this and ask some questions. Connection activities. So these connection activities, I think of more if there's lots of doctor's appointments, you are gone a lot, overnight hospitalizations, all-day infusions, whatever your treatment plan is and however much you may be gone, it typically begins or starts a lot of separation anxiety, especially for younger kids, but older kids too, like they notice it. So some of this stuff I'll go through, and if there's a way we can adjust it for younger or older, you know, we can talk about that. Or if you have a question at the end, please let me know about a way to adjust it for your child's age. I'm happy to work through that with you. So child and mom notebooks, you each have a notebook, and while you're gone all day and you know your child's at home all day or at school, you can write down things about what the infusion room is like, right? Kids, I don't think they're letting, at least where I'm at, kids aren't coming to the hospital. Like once COVID happened, it's like they don't get to come. They don't know where you're at all day. So you can just write about, this is what the room looks like. This is what I'm doing here, just so they kind of know this is what I'm doing all day, because they don't know. They know you're going to get medicine, or you're going to the hospital, but they don't really know what it's like. So writing that in a notebook and telling them about that. And then when you get home, use trade notebooks and they get to share what they did. Again, drawing pictures works just as well. Family mailbox, same thing, same kind of idea. You can make a little mailbox out of a shoebox, and you can write little notes to each other. Or if mom is in the hospital for a couple days, they can write notes, put it in the mailbox, wherever that's at. And then when you get home, you look at all of the mail, and they wrote you letters. They can help pack a bag. That really helps a lot of kids be a part of it. Like, oh, pack this lotion, or help me find some good socks that I can take, or whatever it is. But if they can be a part of packing that in helping you, this is something they can do. That's usually pretty impactful for them as well. Making and wearing matching bracelets. I do this a lot for my adult ICU patients. We have bracelets that match, and the parent gets one and then the kids get one. And some of them might have little letters that say brave or strong or love or family, and they match. So it's just a connection. Like I have a bracelet and my mom has one just like me. Or you can actually, this is sort of related, but I had a sibling and a patient that I saw today, and they decided they would make the other one a bracelet because she's going to the hospital soon, which I thought was just as cute. And that's what they wanted to do. So you could adjust it a little bit. Matching stuffed animals. I do this a lot in the ICU as well. You have a dinosaur, and then the child has a dinosaur, and you can get those little voice recorders. Are reading a story, say, I love you, sweet dreams, I hope you sleep good tonight, your mom will be back soon, whatever you want to say. And you can stick that in the stuffed animal. We usually just kind of cut it open and then suture it back up, but you can use, whatever to sew it back up. And you can get those voice recorders, I think, on Amazon. The Invisible String book is a great book. Have you guys seen The Invisible String or read it? This is The Invisible String. I love this book. Just a connection book, like so you're connected with someone even when they're not there. And there's I have this at the end, but this is the workbook. And so it has a great activities in here to do along with the book. Connection activities, how you're still family, even if you're not together.
Annie, can I ask real quick, what would be the age range for that book? The Invisible
String. Mm-hmm. I would say preschool to school age. And then some of the activities, like I will use them, but I adjust them a little bit for and it's the same thing for the book or for the activity book, the workbook. It's preschool to school age, but there's some that I've adjusted to make them not so young. And I can still use them in a way with teenagers, but preschool to school age is pretty much the most effective.
Thanks.
Mm-hmm. Along with the Invisible String, you could do like a painted stone or a fabric heart, that's a tactile thing. And it's very discreet. So you can have a little fabric heart, because throughout this book, there's hearts on every page. And so you can have a little fabric heart, they can keep it in their pocket, and it's just like a little touch, that they always feel that heart, and you can have one too. Small posters of pictures, like a poster board. And I know we don't really have photos anymore, but this is a great time to actually get photos and print them out at CVS and stick them on a poster, have the kids decorate them. And then if you're going to be gone or have a hospital stay for a little bit, having that poster in the room, kids, I've done this even with teenagers, and it's amazed me how much teenagers will get into doing the art on the poster. And I think then it's like great creative expression, activity and exercise for them too. And then you can put it, of course, in your room. So you have the pictures of your kids, and when you're FaceTiming, you can show them like, look, I have your pictures in here, and it's another connection. We talked about this a little bit, including the child in the days and the weeks plans. I do have, this is one that I just made, right? And like laminated, but I have a resource at the end too that has great calendars with little stickers and magnets. But you could use this as, whatever day, this day I got to rest. I'm treatment, like have a sticker or a picture or something for treatment this day. This day's a rest day. You got soccer practice this day. You're going to grandma's this day. Just a visual for them. Visual for younger kids, preschool, young school age is very important. And so just so they know what to expect in that week, like, hey, I'm going to be gone these 2 afternoons. Again, to talk about who else is going to be there for them. And then the fake matching heart tattoo or drawing a heart on the person's hand. This I kind of think of, there's another book called The Kissing Hand with the little raccoon. I don't know if you guys have read that. And so like it's, you can do a little heart. So again, very discreet. It doesn't have to be anything big. It could be something tiny. So a little painted heart or Sharpie heart or a little tattoo. So you each have one, and like every time you touch that, like I'm thinking of mom and mom's thinking of me. So here, just some of my pictures of things. Now, these aren't mine, but these are things that I've done and that I like. So the pillowcase, you can get like a cheap pillowcase somewhere and do fabric markers on it, and that you can take it with you to the hospital, and vice versa. You guys can do one together. You can do one, and then they can use it on their bed. The second one, that puzzle heart, I like to use as what I call like a support system heart, is how I explain it. And they put their name in the middle, or for older kids, I've done, they pick like an object that defines them, or like a basketball. And so they'll write their name in the middle, and on the outside I have them fill in each puzzle piece with all the people around them that support them. So I might say, who helps you? Who do you know has your back? Who can you always count on? And they'll fill that in. Who always answers your questions? And then it, leads to a conversation. And then you can also just have them help them list like parents, grandparents, aunts, uncles, cousins, neighbors, friends, teachers, whatever. But it's that visual of who's there to help them. I think the next one I'm covered up, it's the stones, grateful stones. So I have these little like stones that I bought, and then we can use acrylic markers or the painted Sharpies, and you can make a big design, and it can be your family, and we can put it in a jar, or we can make a garden out of it, or you can give it to someone. But again, just another way to acknowledge those gratefuls. These homemade stress balls, I've made a bunch, and I put them in that break box, and I use balloons and flour, and it's kind of messy, which makes it more fun. And then we put different faces on it. So I have usually these little pictures of faces, and they get to draw the faces of, and then it helps with feeling identification. So tell me a time when you felt sad. Tell me what makes you mad. Tell me what makes you worried. So you can make a bunch or a couple, but putting flour in them, they're pretty soft, and the kids usually really like doing those. This little jar can be used as, like, you can decorate the outside with tissue paper, markers, paint, and then put the gratefuls in it. Or the other way that I like to use this jar is if you have things that you want to talk about or questions you have, you put the little electric tea lights in there. And when you need to talk, you just turn that on. And then the parent goes to the kiddo to say, hey, I saw the light was on. What do you want to talk about? Again, it's the way that they can say, I need to talk to somebody, but they don't have to say it because that's hard. So as the adult, we're the ones going, we got it. We'll talk to you. And then last one, number 6, is a graffiti wall. So I put this in kids' rooms. It's creative expression. Color, draw, write words on it, write what you're mad about, happy about, just use it to paint and color on. You can also use it in the kitchen and everybody can use it. You can write, your grateful things. You can write questions on it if that's where you want to do like family question board. Why is this happening today? What's the medicine called that mom's taking? So it can be used for that too, or all of those things. So if you use it in a common place, that would be great. Otherwise, in their room. I have a couple kids that like it in their room right now that I use it with. Feelings Jenga. I love playing Jenga. So I take Jenga and I play with kids all the time. I just write different questions on it and they answer it. I put things like happy, brave, what's your favorite holiday? What's one question you have? So if you look on Pinterest, you can find tons of great questions and you could make this. And again, it's a family game, but you can add questions in that provoke a little bit more thought and feeling. And it can just be like, what do you like better, winter or summer? And it just gets a good conversation started. The next one, the hands. So I put this on here really just to show it's what you can and can't control. So the way I would rather use it, not with 2 hands, but 1 hand. And on the inside of the hand, these are all the things I do have control over. And all along like the outside part, all over here, those are all the things out of my control. So it's a good visual of the things that we can work on and a good visual of the things we got to let go, or that we can't do anything about those. But these are the things we can focus on. So the things in the hand we can focus on. And then the last one, that little guy with the big eyes, is my worry monster. I made a couple different worry monsters. I've made ones with like, the little jewelry, like boxes, the little tiny cardboard boxes. And they put eyeballs on them and paint them. And we make the little teeth and we make them silly. And then when you have worries, we put little strips of paper in there. You feed it to the worry monster. And then the worry monster, he's going to take that from you. And you don't have to keep it anymore because he's got it now. So that's obviously for younger kids. But you can adjust that and just have worry stones or have a worry jar. And same thing. Once you write it on that paper, you put it in the jar and then, it's gone. But it's a little bit different when you use the worry monster. I've had kids who are like, yeah, they really like it. I'm like, the worry monster's got it. He's going to take it. So now you don't have to anymore. I also have, and I'll show you, these little guys that I haven't got to use yet. These are little worry dolls. Have you seen these before? They're tiny. And it's the same thing. And it's a little worry doll and you can keep it under your pillow. And you can make these with like clothespins and stuff and yarn, I think. But the worry doll is going to take your worries away from you. So you don't have to. So while you're sleeping, the worry doll takes your worries away. And then you don't have to worry anymore. Because worrying takes up a lot of our energy that we don't want to waste. Okay. Does anybody have any questions or anything they want to ask about? Is that all okay? So here's a few of my favorite books. I have tons of books that I use. I love using bibliotherapy, which is reading a book and then incorporating a therapeutic activity with it, because kids relate really well and it helps them kind of understand the whole concept that I'm trying to teach them at the time. So The Year My Mother Was Bald, that's, I think, more school age. Hey Awesome is about anxiety. And that is one of my favorite books. I don't know if I have it with me. It is a fantastic book. So it really talks about anxiety and how anxiety is controlled by the amygdala, and the amygdala gets a little bit out of control. And he's they have this little monster in the book, but it's an awesome book. Oh, you know what? I'm lying. It's called Hey Warrior, but Hey Awesome is another book that she has. Hey Warrior is the anxiety book. We'll have to fix that. In My Hard Book of Feelings, The Color Monster, My Many Colored Days, that's all for like a younger school age, preschool age, just addressing like feeling identification. The Invisible String I showed you. Wreck This Journal is for like teens. It's a great teen book. It has a lot of prompts in there. scribble on this page, tear this page out, write about, whatever. So that's a great teen book that I like. Someone I Love Has Cancer is this book. And I have this at the end too. This is a great book. One of my favorite things about this book that I use, let me show you. I have because it talks about, excuse my little notes, because I read it differently for different kids. It talks about like healthy cells and cancer cells. So it's a great visual. And then I use this with Play-Doh too. So there's your healthy cells, there's your cancer cells. And then sometimes I will have a cutout of a body and then we make the healthy cells and the cancer cells with Play-Dohs. But that's a great book. It's a little bit lengthy, so more school age, but you can adjust it, skip some pages for like a preschool age kid. The Kissing Hand is probably more preschool, and then up to maybe second grade. My Parent Has Cancer and It Really Sucks. That is written by a child and father whose mom had cancer. So that's teens. The Hope Tree is school age, and Butterfly Kisses and Wishes on Wings is also like a school age. And then here's just a few resources for you that are helpful. Child Life on Call has some great podcasts. A lot of it focuses on parents. The host, Katie, talks with parents of children, but it has some great resources still about just interacting with as families. It has great online resources and printables that are helpful for any type of any illness, and just really focuses on the children. Wonders and Worries is an awesome organization. I believe they're based in Texas, but they have a great website with online resources. They have a podcast, and I think, sorry, I gotta move this. That Teen App Sup, I have not looked that up yet, but it is for, obviously just for teenagers. And it's from Wonders and Worries is what reputable organization inside. So that's like a support just for teens through an app. But Wonders and Worries has great online printable things that you can always reach out to them. They work a lot with children of adult patients. Mighty and Bright, that was this book that I showed you. The Someone I Love Has Cancer. And then they also have a lot of mental health information and resources. They have the routine charts on there with stickers. Childlife.org, that's my the Child Life governing body, the Association of Child Life Professionals. And on their main page, they have resources at the top for parents, so you can go on there and there's information on how you talk with kids about different things. And then I'm listed on there, so of course you can email me about any questions or resources or things that you need, or you can hop on my website and reach me through that as well. I'm happy to. I typically go to, when I see a family, I go to their home and I bring all my supplies and we work on whatever the family is needing at the time. So please feel free to reach out to me or through Carrie, and she could let me know.
Yeah. Wonderful, Annie. Thank you so much. This was so helpful, I think. I have a great question from someone that couldn't attend with us tonight. She said, my daughter is so scared to go to the doctor ever since I've been diagnosed. How can I help ease her fear? She's 13 years old.
So I think what I would say, working with her just initially without knowing a lot of other things going on, it makes it a little bit, harder because it would be very specific, but it would really defining the difference in mom's illness and what she's going to the doctor for. Because I think I've talked about this before, making sure that they understand and a child understands this illness and this diagnosis is different than when we go to the doctor for a cough or a cold or a fever. We can usually just get better. This is different, and we got to take some different medicine and do some different things. And that could be part of it. She could be worried that what are they going to find out that I have, or what are they going to tell me? That could be the fear.
Okay.
But I think it would take kind of working through that with her, doing some different therapeutic activities and talking about going to the doctor. What do you usually go to the doctor for? What are you going to the doctor for this time? Really talking through and just clarifying anything.
Right. Yeah. I really liked the question Jenga. I think that, because that
it's
seems really, Yeah, for any age, I feel like you could throw some questions in there and they could learn something about you along the way
Definitely.
that they may not know. So,
and I always participate when I do it. Like I even do it sometimes at my grief groups at schools for middle school. I'll do it, and they get really into it, and it just kind of gets the conversation going with them. If they're being a little bit like nobody's really talking, once we start playing, they just kind of start sharing stuff on their own.
I love that. Thank you so much, Annie. We appreciate your time.
Yeah, absolutely. My pleasure.